Is there a way to lessen some of the side effects of Accutane? That's what we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute. And as many of you know, we are a dermatology practice specializing only in the treatment of acne. We understand that there are many acne sufferers who are looking for information to help them navigate the path toward clear skin. So we hope you find this useful. But remember, again, this is not medical advice. So in today's video, we're going to talk about ways that maybe we can reduce some of the side effects of Accutane. So one of the most common side effects is dryness. And dryness can be the skin, it can be the face, the skin of the face, it can also be skin on the bodies, the hands can get very dry. So it affects all of the skin in the entire body when you take Accutane. So some patients end up with very dry skin, and sometimes they get a rash on the backs of their hands, for example, when they go to wash their hands a lot. That makes the dryness even worse with the soap and the cleansers that they use. So one of the things that's important is to moisturize, especially the backs of the hands. Keep them very moist during the treatment, and that will help to lessen the likelihood of some significant dryness that may lead to inflammation or irritation or a rash on the backs of the hands. Same thing for dryness of the face. I think it's fairly well known by most people who take Accutane that they need to moisturize. They need to use an acne-safe hydration technique to keep their face moisturized. And the lips, that's another common area. The lips get very dry. They're probably one of the places that gets the most dry. So we want to really emphasize moisturizing the lips to keep them from becoming too dry, because then they can become cracked and they can become very uncomfortable. But thankfully, most patients who take Accutane, they tolerate the dryness very well because they moisturize, and really they are able to tolerate the dryness without any significant discomfort. Now, the eyes can also get dry. Most of my patients don't typically complain of dryness of the eyes, but occasionally some do. And sometimes they may need to use moisturizing eye drops that the eye doctor can recommend. And sometimes the nose can get very dry. So the nasal passages can dry out with Accutane, and in some patients that can lead to a minor nosebleed once in a while. So we also advocate moisturizing the nose. And how do we do that? You can go to the pharmacy and get a nasal mist spray that can help to moisturize the inside of the nose. Now, another thing that can be useful in a more recent study is the use of omega-3. So omega-3 supplements sometimes can help with that problem, with the dryness, and it can mitigate some of these effects. And so that's something that can be considered, and you can discuss with your doctor about how to incorporate omega-3 supplements into your regimen. And there are other factors. For example, we can reduce the dose of Accutane if somebody's having a significant dose-dependent side effect. We can also change the way we're giving it. For example, maybe instead of taking it every single day, you might take it only 5 days a week instead of 7 days a week. Or maybe 1 week on, 1 week off. There are so many different ways of using Accutane successfully. So this is a discussion to have with the doctor giving you the medicine, so that you can make sure that whatever alteration is done in a safe and effective way. So some of these side effects are dose dependent, and they can be helped by various techniques. Some side effects are not dose dependent, and even taking Accutane in a very low dose can also still have a risk of developing a particular side effect. So it doesn't completely eliminate that potential. But for the most part, there are these techniques that we can use and incorporate into the treatment regimen that can, in fact, help to lessen some of these more common dose-dependent side effects.